Carpal tunnel syndrome is a condition which is caused by the compression of the medium nerve as it passes through the carpal tunnel pathway, which is a narrow pathway between the bones of the wrist and hand. It is caused when the tendons and muscles of the wrist compress onto the medium nerve as it passes through. This can have many causes. Primarily, they are injuries to the hands and wrists, such as broken bones or sprains and strains. This can also be caused by medical conditions such as obesity and diabetes. Other neurological conditions can apply as well. It can also be caused by repetitive motion and poor work position, such as typing on a keyboard, or in my case, turning conduit over a 24-year career with this motion. It is characterized by pain, numbness, tingling of the hands and fingers, and sometimes locking up of the hands to the point that they simply cannot be opened without aid. There are 4 known remedies for this. One is physical therapy, where stretching exercises are used to free up and loosen the tendons in order to take the pressure off the medium nerve. The second is oral steroids or other medications, anti-inflammatories as well. These are used again to release the tension on the nerves and tendons. These have been proven to be as effective or nearly as effective as the next option, which is more common, which is injected steroids. These steroids are injected directly into the tendons and done by using an ultrasound machine to guide it straight to where it needs to be. This is the more common remedy for this. It is a temporary measure. It does not cure the carpal tunnel. It simply buys time. For some patients, it can be a week or a month. For others, it can be years. The only true cure for carpal tunnel syndrome is surgery. There are 2 types of surgery. One is open surgery, where the wrist is opened from approximately here to here. The skin and muscle is removed from the affected area, or moved, I should say, and the tension on the medium nerve is released by cutting and reattaching the tendons and ligaments of the wrist and hand. This has a healing time of approximately 4 to 6 weeks, at which time full mobility is restored in most cases. Some, however, report pain and tenderness in the cut area in up to a year's time afterwards, though not nearly as severe as the cause itself. The other and the less intensive option is endoscopic surgery. This is where a small 1/4-inch incision is made approximately here, and an endoscope is pushed in with a small camera and a blade. It is pushed in until it reaches the tendons which are causing restriction, and they are simply cut and left to heal on their own. The heal time on this particular surgery is approximately 5 to 7 days. It has been proven effective and has a 100% heal rate. Ultimately, the option you choose is up to you. However, going with the most effective option is always the best choice, and getting checked early when you first feel the symptoms is the most important step. I hope you found this helpful. Thank you very much. My name is Wade Rutherford. Goodbye.